All right, guys. Now this is Forrester's Financial and their Planright whole life plan. Okay. Forrester's has a couple whole life plans, I think one or two. But this one is their Planright. Okay. And no, it's not Planright Financial. They had this product way before Planright was even a thing. So let's jump into it. Okay. There's three different risk classes when it comes to Foresters. Okay. We have preferred, standard, and basic, and they're all just a little bit different. Okay, as far as their preferred, it's going to be the best premium. It's a level death benefit, and it's best for healthier people. Although they do accept a few health conditions that a lot of other preferred ratings typically don't. Okay, now their standard rating, it's also a level death benefit, but what they do, instead of penalizing the policy itself, like they do with basic, they just penalize the premium. Okay. They just make you pay just a little bit more for the same type of plan. Okay. However, it doesn't come with that standard accidental. Okay. Like you can get with the preferred rating. Okay. Now, basic. This is their graded death benefit. Okay. So years 1 through 2, it's just the 100% of premiums paid. Okay. 110% premiums paid, like return of premium plus 10%. That's how that works. Okay. And they also penalize the premium at the same time. Typically, their basic plan is only maybe a couple dollars more expensive than their standard rating. Okay. So if you're going through Foresters and you're running out of time and you don't want to jump into like Mutual Omaha graded or another product. You can just run, if you know it's going to be a graded product, you can just run Foresters Basic. It does penalize your commission a little bit, but at the end of the day, it's about our clients. Okay. So that's where the Foresters Basic would come into play. They typically have like higher risk health conditions that they accept. So some automatic decline conditions when it comes to Foresters. Even though they do have three different ratings, they do have some automatic declines. Okay, one of them being congestive heart failure. Okay, like or CHF, cardiomyopathy, Alzheimer's and dementia, current hospice or home health care, or help with ADLs, which is activities of daily living. Um, Another one is organ transplant ever. Okay, and that's pretty much most of the companies that we work with, besides like American General on their GIWL. It's going to be like an automatic decline when it comes to organ transplants. Okay. Um, Oxygen use within 12 months, wheelchair or scooter use due to chronic illness, or maybe even confined to a wheelchair. If they broke their leg or something like that and they got a scooter, that's a different story. Okay. We're more looking for people who depend on the wheelchair. Okay. Because of some sort of chronic or critical illness. Okay. And then terminal illness or end stage disease like stage 4 really cancer or kidney disease, stuff like that. Some heart and circulatory guidelines when it comes to foresters, because they're typically the company that we go to when it comes to heart conditions. Okay. If a client has a heart attack within a year, it's going to go basic. Okay. If they have it within 2 years, like 1 and 2 years, it's going to go standard. But if once we get out of that 2 year window, then we're going to be able to get their preferred rating as long as other things aren't wrong with the individual. Um, Now, stents, 12 to 24 months, we're good on standard. Once we get out of that 2 year window, then we're good to apply for the preferred rating. Okay. Same goes for strokes and TIAs. 12 to 24-month window, we're looking at a standard rating. Once we get out of that 2 year window, we're looking at preferred. Okay. Blood clots at all, current blood clots included. Um, we're going for a preferred rating. Okay. Um, Angina, 12 to 24 months, we're going standard. Once we get out of that 2 year window, we're looking at a preferred rating. Okay. AFib or irregular heart rhythm, we're going to preferred rating. And then coronary artery disease or CAD or CAD, it's going to be preferred. Now, diabetes. The diabetes with or without insulin, it's going to go preferred. However, if there's any complications at all, okay, whether it's because of insulin or not, if the client has diabetes and they also have neuropathy, nephropathy, or retinopathy, etc., it's going to go basic. Okay, and then diabetic amputations are an automatic decline. Now, respiratory conditions like asthma, COPD, stuff like that. If it's just mild asthma, like they have like an albuterol rescue inhaler and they only use it here and there or during allergy season, that's going to be preferred. Okay, that's not going to be considered chronic asthma or COPD or emphysema. However, chronic asthma, COPD, emphysema, these are all going to be a standard rating. Okay, automatically. As soon as you hit that question on the application, it's going to immediately push it standard. Okay, so if your client has any of these conditions and you know it's going to be standard, just mark standard at the beginning. Okay. Now, oxygen use within 12 months, it's an automatic decline. And then nebulizers are not automatically oxygen equipment. So make sure you know your facts as far as that's concerned. Okay. Because the client has an inhaler, but they use a nebulizer, that's a standard. Okay. Or even, you could even go preferred if they have asthma and they just take a breathing treatment here and there. Okay. That could still go preferred or standard. Okay. So be careful with that. Current cancer, as far as cancer is concerned, current cancer is an automatic decline. Recurrent cancer or multiple types or multiple times, automatic decline. Metastatic cancer means cancer started in one place and it moved to another. Um, for whatever reason, it's an automatic decline. Um, Cancer treatment within 3 years, it's going to go basic. And once you get out of that 3 year window, then we're good for a preferred rating. Okay. Now, however, basal, I don't know why it says basic, but basal or squamous cell skin cancer, as long as it doesn't go internal, it's a preferred rating. And there's no look back on that either. Okay. And then certain cancer maintenance medications is going to be a decline. Like if a client had cancer 5 years ago, but they're still taking some sort of cancer medication like Zofran, which treats like cancer related nausea or just nausea, but they have cancer history and they're taking that medication, it's going to be an automatic decline. Um, Shoot. Some common basic triggers. That's going to be recent heart attack, stroke, or TIA, alcohol or drug treatment within 2 years, Parkinson's disease. That depends on the medications. Parkinson's isn't necessarily going to push it basic. However, some medications or combinations will. And then obviously diabetic complications. Some standard triggers, we're going to have hepatitis B and C, cirrhosis of the liver, Parkinson's, like I said, depends on the medications, systemic lupus, kidney disease, as long as they're not taking dialysis, COPD, emphysema, chronic bronchitis, chronic asthma, lung disease, stuff like that. It's going to be a standard rating. And then heart attack, stroke, TIA, angina, having a pacemaker, defibrillator installed within 2 years, all of these within 2 years. Okay, the heart attack, stroke, etc. It's going to push it standard. Um, as far as death benefits, okay, their preferred rating, their standard and their basic are a little bit different. As far as the preferred rating is concerned, starts at 5,000 and ends and caps out at 35,000. And you also have that accidental death benefit offered for an additional premium. Okay, however, for their standard and their basic death benefits, we're looking at 5,000 to 20,000 only. And that's it as far as foresters is concerned. I'll see you guys on the next one.